For a little bit of background and introduction, Professor Cindy Tripp is a leader at the forefront of business, either through establishing new ways to achieve stronger results throughout her 30 plus years in business. She is a thought leader in design thinking, also known as human-centered design, and shares her wisdom and skill with a variety of industries, including healthcare, consumer packaged goods, services, and nonprofit organizations through her own consulting practice. Cindy is effective at leading change and helping others change as well, establishing the practices of design thinking and communications planning at Procter and Gamble, as well as propelling forward P&G's marketing strategic thinking and branding, targeting, insights, activation, and word of mouth through her 24-year tenure at P&G. Cindy's key strength is the ability to integrate the empathy and imagination of design with the practicalities of business in a way that can help business deliver results now and in the future. Her in-depth understanding of insights, branding, strategy, and design thinking integrates into her unique and strategic approach to innovation and business building. Let's give it up for Professor Cindy Tripp as she shares her presentation.
Hi, y'all. Thanks for having me. Glad to be here. I'm actually on vacation right now. I'm at the beach. So I just came in and took a shower for you all so, so that I actually am presentable. So did you integrate my presentation into a master deck or am I sharing mine? Either way works.
You can share yours.
Okay, yeah, that's good. I'm happy to do it. That's good. PowerPoint. There you are. Okay, let me put it in this mode. Hopefully you all can see it.
Yep, looks good.
Importance in empathy and healthcare. That's what we're going to talk about today. I know you've been talking a bit about healthcare, maybe more from a physiological or political public policy standpoint. I'm going to take it down really small into the space where I've been able to operate, which I love, which is about in the relationships between people having empathy for one another. It's so powerful. Yes, anything that you do in life, you have to have the technical, obviously treat the disease or give access to the people. But then when you engage, how are you engaging? Are you engaging as the expert all-knowing? Or are you engaging as a human being with other human beings? And I think that's the lens that I want to bring today to our discussion. Hopefully that will be interesting to you and maybe learn something in the process. Does this sound like the right focus? Yeah? Okay, I see a little applause there. I'll take it. All right, so I'm just going to put it a little more so I see more people. I like seeing you all. Adam referred to me as a professor. I am not a quintessential professor. I am an adjunct type professor. I was an adjunct professor at UC for 5 years, and I'm currently working with Northwestern's Kellogg School of Business right now. I guess speak at a lot of schools, but I am not a professor classically trained. I do have a master's in business, but I don't have a PhD. So I'm one of those kind of professors. Maybe you've had a few of those because we come with more practical knowledge and a little less, a little less academic. So I found my way into design thinking while at P&G. And we saw that there was, and human-centered design and empathy while at P&G, we saw that there was something really special about designers and that they didn't look just at the data, they looked at the humanity of people a lot of times when they did their designs. And we said, wow, there's something really there that's more meaningful than just, creating a package. It's like really understanding where someone's coming from. It's so powerful. So I started studying what they did and how it could be applied to everything we did at P&G. So we applied it to business strategy, to finance, to marketing. I mean, we found IT, we found that really getting to empathy first and understanding people empathically was really powerful. So that, that's how I wound up in this. It was just, we started getting curious and then we studied it and saw it was valuable. And then we created the discipline and now it's used across the company globally. About the same time that that was happening, Stanford D School was launching the D School, which was all about design thinking and empathy in healthcare. You were starting to see other practices pop up, and that was in the like 2000. What was the 2005 range of time, 2005. This was a healthcare really started tapping into empathy in healthcare at the Mayo Clinic and the Cleveland Clinic. They were kind of pioneers in this, saying there's got to be more than just the medical way. There's probably a better outcome if we treat people as humans. And so they both have pretty dramatic practices. I want to check in with folks, maybe in the chat. How many people have seen the Cleveland Clinic video, empathy video? So if you could just in the chat, let me know if you have seen it so I know how many people have seen it. I may not show it. So I'm going to, where's my chat? I've covered you up. The chat is covered up because I moved my people around. Let me go pull it up. All right, so what are people thinking? I have not seen it. I have not. So 50-50 so far. So a lot of people haven't seen it. I do want to, I do think it's pretty important to understand what we mean by empathy. And so given the number of people that have not seen it so far, unless a lot of people have, just right now we have a few more that have not versus have. I'm going to actually leave my presentation and let's see. I have not. Okay, so I'm going to stop this share before we get into it, and I'm going to, let's see what I'm going to share now. I'm going to share my, I don't see it up here. So I guess I'll just share my desktop. That'll be fast. I'll go to, where are we? I thought I had it up. I guess I did not have it up. So let me, well.
If you want, I can go ahead and share it. I have the video pulled up.
I've got it.
Okay, perfect.
I have it too. Here we go. Can you all see this? Okay. So I'm going to stop it there. The rest of the video is very similar. But I think the key to this video is that um, there is more to a person than just what you see on the surface. And in healthcare, I think the way to think about this is you are not just your diagnosis. Is everyone seeing the slide? Just double checking. Yeah, good. So the world in healthcare 20 years ago, the doctor was at the center of the universe, and everything was designed around optimizing the doctor, okay? The doctor availability, doctor patient interaction. My dad's a retired doctor. He was at the center of the universe in his practice. He was a surgeon, and everything revolved around what he was able, what he could do, what he was able to do. Now, the world is shifting as we become more attuned to empathy need in healthcare, that you are not just your diagnosis, and you are also not at the beck and call of the surgeon. You're more, the patient is more at the center, and they are fuller human than just their diagnosis. So when you see this is my daughter, she's on her, this is when she was 15 battling leukemia, and she's now 23 battling leukemia again and doing well, so no worries there. But you know, when you look at her, you see the lack of hair and you immediately think cancer patient, but there's so much more to her than that. And you know, as a doctor, you should be looking beyond the obvious to who she is as a human being. And where she was treated at Cincinnati Children's, they did a phenomenal job of doing that overall for the most part. And so, you know, her treatment, they looked at her as a human being with aspirations and concerns and interests. And so that human side was present. She had a condition that was a side effect of her cancer treatment that resulted in basically killing her knees. So it's called avascular necrosis, deprives the knees of oxygen. And so we had to go see a specialist in children's for that specific thing because she risked losing the ability to walk. So we needed to go see this orthopedic specialist who specialized in avascular necrosis. So we had been accustomed to be treated like a person, but this is what he presented to us. The back of his head facing the x-ray, talking about the issues, and never once looking at my daughter. Technically, he was the most brilliant person in the room, you know, and he was the person that she needed to look at this and to assess it. But he was all about the treatment and the disease. And she, as a human being, felt uncomfortable. She felt unseen. She felt disenfranchised. And what she did, instead of that smiling face that you see, she absolutely just shut down. Her head went down. She was looking at the ground and her legs were, nervously moving. And she didn't look up to talk to him, and she didn't answer his questions. That hurts healthcare. If people are not going to engage and tell their doctor what's going on, how can the doctor do what he needs to do? I mean, healthcare is a two-way street. Now, she was accustomed to children's, and she was in a pretty good situation because she'd been talking to doctors for months as part of her leukemia. And yet she shut down when she was treated as a diagnosis. Can you imagine if someone is not as familiar with the healthcare industry going into a meeting like this and the doctor is just back to you looking at the picture of your x-ray? So, I think this is a really interesting story because I had been doing research with the hospital at the time, and I had a mom of a very sick child with chronic issues. And she said, my child is way more interesting than his diagnosis. My child has so many things he's funny, and he has, he likes to talk to people, and he has so much going on. But sometimes people just look past that and look at his disease. And, that's a shame because you're missing out on the fuller picture. And oh, by the way, what success is for one patient may be different than what success is for another based on who they are. You know, what I want and determine as freedom and what someone else determines as freedom to walk around may be different. You know, my daughter at the time was a competitive tennis player and she was losing the use of her knees, and you know, she said, "Can I play tennis again?" And they said, "So." Um, you know, she had to come to terms with that, but it was important to her that she not be in a wheelchair and that she be able to walk. And they adjusted her medicine to allow that. And so today she walks fine, but she can never do high impact anything again. But they adjusted for what her needs were, and that comes from conversing. So when I think about empathy in healthcare, I think it's about not what is the technical standard of care, but what is that and what this person is needing, which may be totally different than another person. And it takes more energy, but it doesn't necessarily take more time. It does take more energy. I've talked to doctors about this, and they say it's so hard to be empathetic with a patient because then we open ourselves up for hurt too. And so, you know, it does take more energy, but it doesn't necessarily take more time. It doesn't take that much time to look someone in the eye and talk to them directly and get to some rapport established and some sense of who they are before you turn to the diagnosis and the work there. So, you know, you're not just your diagnosis. Empathy is required to treat a person as a person. And I think that healthcare is awakened to this. It's pretty incredible the number of places that now are following in the footsteps of Mayo Clinic and Cleveland Clinic. But it's not everywhere, and it's not every healthcare provider, right? It's not everyone. But it is a big opportunity. And I think that um, I've done a lot of work with hospitals on getting their care providers to start to see the world from someone else's lens so that they can understand how to connect better and how to partner better on the healthcare. Now, it's even more difficult when you are not similar to the other person. We'll talk about that in a minute. I do want to mention that the other person needing empathy in this space is the care provider. So yes, the doctor came in and went straight to the diagnosis, but he was having a day. He was having a day too. Who knows what had happened before he came into the room, which that Cleveland Clinic that video does an amazing job of showing that there's so much else going on in our lives that we don't see going on in people's lives, and yet they have to show up. Um, I did some research with nurses at a hospital, and they were burning out, and the turnover was really high. And so we were trying to understand. And you know, one of the things that came out of that was this imagery of the nurses in a whirlwind. And basically, what's happening in her day is emotional ping pong. So let's say she has 4 rooms to juggle that she's taking care of. Room 1 is irritable and angry, so she pops out of there to go into room 2 with someone who's super happy, you know. And room 3, they're kind of sad, and room 4, they're crying and upset. And she's having to adjust every moment. And oh, by the way, she just got divorced. She just got a call from her kid's school that her kid is sick. She just got, you know, chewed out by her supervisor. You don't know what else is going on, but she is having to walk into each of those rooms and meet people where they are and have some empathy for them. It's a lot of work. It's a lot of work. In that instance, we realized that there needed to be a recovery space for nurses in the ward where I was working on the turnover, that they needed a place they could go and reset because of this emotional ping pong. But I think, you know, first is you have to recognize that whatever role we're playing, we're coming to it from a place. We're bringing with it our baggage, as are the care providers, as are the patients, as are the parents or the friends or the loved ones. And we have to make space for us to accept that and meet people where they are. I'm going to pause here. You know, what do you think? What do you think about this idea that you have to do more than just have the technical competency? I'm going to pull up my chat to see if you all any thoughts.
Personally, I'm curious about like how do you cope with constantly dealing with different situations, scenarios, emotions? Like how do you maintain a a happy and empathetic perspective when at times it can be draining? Um, yeah.
Yeah, I mean, I think I think that is the challenge, for sure. What I think the first step is to acknowledge that that exists, that there is this incredible pressure. I mean, in this instance, with this group, we're doing this work. They had never thought about the nurse's perspective, the whirlwind, the ping pong, all of this really helped them to realize they were they were expecting too much, to be accomplished by the nurses, and and so you start to look at creating a recovery room, doing some breaks that are not previously integrated into the schedule. Those were the kinds of things they started to design after they understood this, because recovering her energy when she leaves that angry room in room one, and maybe they've thrown something at her, I don't know. I don't know, but I know when I was in sales training at P&G, I went into a store that hated P&G, and the guy threw a jar of Jif at me and picked up his shotgun. Well, I came out of that like trembling, and I was in sales training, so I had my little car, and I was going to go to the next store. I had to go to so many stores in a day in sales training, and I'm sitting in my car in the parking lot of his store, like shaking uncontrollably. I'd never had anything like that before, and I had to recover and make my next appointment. That's where meditation comes in, some breathing comes in. I mean, personally, for me, when I'm in a situation where I've had something like that happen, I try to do slow 10 count deep breathing. It's amazing what getting oxygen into your body will do for you. But these are the kinds of things you can start to work with people on if you see it, if you name it, if you say it's important to recognize that we have to have empathy for our nurses and our doctors. I mean, I don't know what was going on with the doctor that came in for my daughter and just ignored her and only seemed fascinated with her x-ray. My guess is he was having a bad day. That's my guess. He was harried and he forgot. And so then you have to think about what are the cues you can do that allow people to do a better job, and even like, why does the x-ray machine have to be on the wall opposite the table? You could literally design the room to put the x-ray reader next to the table, right? So there's simple things you can do that will evoke those kinds of positive behaviors. But if you don't see it, you don't acknowledge it, you can't design for it. And so I think as we think about empathy in healthcare, first we have to see what's there. And to great benefit of patients, we are beginning to pay attention to this kind of data as important data in the treatment of someone, which is fantastic. I'm going to keep moving on. I want to give you my little mnemonic that I use. So, COG, okay? So, how do you connect? How do you get people to have a rapport in a way that they can even have empathy for one another? How do you even start this down this path? And this, it sounds crazy, but this little acronym to me gets me out of a lot of trouble because the first thing in COG is to connect as human beings. And that means looking at someone in the eye, and that means having space to hear what they have to say. I mean, it has to be step one. So before you start talking the knees, look me in the eye, look my daughter in the eye and say, nice to meet you. I see you're a sophomore in high school. That must be, exciting year. Are you enjoying school? I mean, you can start anywhere. You can say, I see that that you're on mock trial. That's interesting. I didn't know they had mock trial in high school. You know, have some cute, you know, or tell me what you do when you're not here having your knees looked at. You know, you can do whatever it is to kind of get that first connection moving. Um, Moms and babies have empathy. That's why I picked this picture. A mom just knows. She knows when her baby needs something. She knows what the cries mean. They're very in tune with each other because they get this great eye to eye connection. They have this great uh, kind of ecosystem that they are both a part of. And that's what we're striving to do, to connect. Then once we're connected, then we can orient to why we're together. So, you know, before you start going and doing whatever it is you need to do, you need to make sure people know why you're in the room and what you are talking about. So get to know me as a person, as a patient, then orient me. I understand today you're in because you have knee pain, and that's something that we think is avascular necrosis. And I'd like to show you the x-ray and let's take a look at it together. Now I can go to the x-ray with my back to you, and you followed me there because we've created the pathway to rapport, which leads to empathy. I mean, all those things are very simple to do. So this works in business meetings too, by the way. It works in connections with people you're meeting for the first time. Maybe you have some business to do with you know, the finance the bursar at the university about, you know, student loans or something. I don't know. You have something like that you have to do. You don't just go in and start talking about this. You can, but that's not very empathetic. It's better to go in and say, hey, it's good to see you. How are you doing today? You having a good day? You know, let them talk, hear from them. Great. You know, well, I was just a little confused by this letter that I got from you, and I just wanted to see if you could walk me through it. All of a sudden now when we go to it, we're in a much softer space than if we had just come in and said, why did I get this letter? Right? I don't understand why I got this letter. See the difference? It's a little softer, but it's recognizing the other person is a real person and not just the bursar. So so cog is one of those things to keep in your mind. Have I connected first? Did I orient nicely? And then did we go get on with it? So that is something that I work with my teams on when they go out to do, you know, even their anthropological interviews where we go into people's homes or we go into the hospital. I want to make sure that they don't just go to their questions, but they spend a little time getting to know the other person. And that can be a little bit of time, meaning 1 minute, or it could mean, you know, half an hour, depending on what the activity is. So I mentioned before, you know, this connection, orienting, and then getting on with it is a heck of a lot easier if we're, you know, gosh, we both belong to the same church. We both have the same ethnic background. We both have the same socioeconomic thing. It's a lot easier to do that connection and that empathy work than if someone looks completely opposite of you. And so one of the other things you asked, how do you go about doing this? You have to suspend judgment. You can't look at a 14-year-old or 15-year-old girl and say, oh, that's just a kid. You have to suspend judgment. You can't look at someone that looks and dresses very differently than you and say, they must be, I'll make back of my day, they must be a pothead. No, you can't judge that. You can't make a judgment before you put yourself in an orientation of learning, which is listening and observing. So I wanted to talk about this in the case of a real case that I did with a client. They had an issue where it was a children's hospital. They had an issue where the same day surgeries, you know, the small surgeries that don't require overnight, but you know, you spend the day in the hospital and then you go home. So maybe you're getting your tonsils out, you're getting ear tubes put into your baby. Those kinds of surgeries, they're important, but they're not life-threatening necessarily. So they're called same-day surgeries. And they had a huge issue of cancellations on the day of the surgery, which is so expensive because then you have an operating room that's idle and you have a patient that's not getting what they need. So, it's bad for the hospital, it's bad for the patient. And they're like, we don't understand it. So they started doing some analytics to study it. And they discovered, which is so interesting, that the cancellations were happening among African American low income families within 5 miles of the hospital. Like close. It wasn't like it was people coming from out of town. It was, a predominant ethnic group, a predominant socioeconomic group, but they didn't know why. They didn't know why they were canceling. They just knew who. And this is what happens in healthcare so often. We have lots of data on kind of who, what, but not so much on why. And you have to sometimes go to empathy to get the why, right? You have to go to empathy to get the why. So, met with the people that were concerned with this, and they were giving me their hypotheses, and there was a whole lot of judgment going in there, a whole lot of judgment that may or may not have been true, but they had all these hypotheses that I thought were judging first. So we went out, actually this was a project my students did. We went out into the homes and into the community where this was happening and talked to some moms. And we learned quite a lot about these women. They were amazing women. This one, and this is not actually her picture, this is a magazine picture to represent for privacy. But this woman, in made-up name, Kanisha, she, worked very hard. She had gotten her GED education, which, was so exciting because that was opening up opportunities for her. She had 3 kids, 10, 6, and 2, and a cat. But she was the safe haven in her neighborhood for all the kids, okay? So she had all the kids would come over to her house after school and things like that. So, and she relied on other people for transportation. And she often used the transportation that was provided by one of the local services, social services. The day of her child's, I think it was the 2-year-old surgery, the social services truck had a check engine light came on, and they informed her they couldn't pick her up, and she didn't have another way to the hospital. She also had, the person that was supposed to watch her other 2 kids canceled on her. So she didn't have childcare for her other kids, and she couldn't bring them to the hospital. So she canceled, and, and she canceled late because this all happened the day of. So all of a sudden you start to see a different story than maybe some judgmental things that you're presuming. And there were several people that we interviewed like this, and at the end of it, you start to realize, oh my goodness, what's going on here has nothing to do about the love of the mother for the child or the engagement in parenting, and it has everything to do about engagement in parenting, and really just barriers to being able to get to the hospital. When they learned about these barriers and how this was major, was what was going on, they rewrote their grant for federal funding to include support services that with a hospital would do to get people to the same day surgeries. And so that allowed them to take some great action. So one of the ideas that the students came up with, that pieces of it were picked up by the hospital, was literally when you sign up for a same day surgery, you get a path to surgery booklet that tells you every day what you need to do to get ready for surgery, all from her perspective, and what resources are available for her, and including creating a healthy kid area for kids to be babysat at the hospital for their lower income consumers who need babysitting help, because that is a major barrier we discovered, including if your transportation falls through the last minute, sending some sort of courier to go get you for it, especially since it's within 5 miles of the hospital. It's not an undue burden on the hospital. Creating, this was a barrier. Many people worked in low wage, minimum wage jobs. And if you miss work, you lose your job. And so creating some sort of system with, this is just an example of what they do for people at school, but creating an official absent for healthcare reasons slip to take back to your employer that kind of explained it. And then when you start this path to surgery, giving them a track phone with a few minutes, because a lot of folks had phones that you had to add minutes to, and they couldn't afford the minutes to call with questions to the hospital. That was a barrier, being able to use the phone. So giving them a phone with plenty of minutes. So these were some of the ideas, and then also having snacks and food for the things they need in the hospital while they're waiting. So this was an example of how people used empathy to get underneath, to understand really what was going on, what were their motivations, and then started to problem solve. And then this went into a grant that then got some dollars for some of these activities. So again, it all started with deferring judgment and having some empathy. And critical to this is being willing to see things from another's point of view. You have, even if you disagree with someone, you have to be willing to say, for the next 4 hours, I am not going to disagree. I'm going to accept it and let it wash over me and see what I learn from it. And that's what's really hard about empathy work, is that you have to be willing to be wrong. You have to be willing to not be the person that knows the most in the room. I mean, that's really the challenge. And when you do it, you unearth these insights that really unlock all kinds of ways to make a situation better for someone. And, she wanted to have her child have his surgery, but she didn't want to leave her kids unaccompanied at home. And she didn't have a way to get to the hospital. Those things can be handled through other mechanisms if we know about them, if we understand what the barriers are. So this was a pretty exciting project. Every time I work in healthcare, we get the simplest insight that unlocks so much. And I've worked in, psychiatric hospitals and unlocked things that were just like, wow, I had never thought of it that way before. Absolutely, that's what's going on. I've worked with doctors, I've worked with patients, and every single time, if you start letting go of all your preconceived notions and you allow yourself to see the world from their side, you see something that you can help. You can help. So that's kind of an exciting thing. And again, both of these women have needs, and they might have the same need, or they might have different needs. It doesn't matter what they look like on the outside. And so I think you have to, whether you more affiliate with the one on the left or the one on the right, it doesn't matter. When you're in the room with the other, you need to just embrace and love them. And part of empathy is just being willing to love whoever's in front of you as they are. And I think that that's challenging sometimes for people. But to me, that's how you get to empathetic healthcare, is that you walk in the room with an orientation that, they're worthy of being heard. And then worthy of being heard. So those are the two key things I think that are critical when I think about healthcare. Is a patient is not just a diagnosis, and don't judge before observing and listening. To me, why do I care? This came out of a book called The Magic of Design. And, John Calco makes a really good point that empathy is the key that unlocks wisdom, and that data becomes information, becomes knowledge over time. But we don't get to wisdom until we understand the why, and that link is empathy. I'm going to pause. How are we doing on time? I want to open it up to questions.
I think we have time for a couple questions. If anyone has any, just throw your name in the chat. Go ahead, Matthew.
All right. Well, thank you so much for coming to our speaker series and talking to us about this. I think the perspective of somebody who worked at PG&E, no, P&G, sorry.
Yeah, yeah.
But um, just that business perspective and is not something I'm used to knowing, but it seems like you do research and you do analytics to find out solutions in healthcare even, which is nice to see that crossover. So
Well, I did that outside of P&G. So yeah, the same
Mhm.
process, different clients. Yeah.
Okay. See, again, I'm not as familiar with the world of consulting and all this stuff, but one thing that I wanted to touch on was the idea of empathy in healthcare is very similar to something that Dr. Lewis mentioned earlier, with deference and approaching a situation in a deferent position. And
Yes. Yeah.
I thought that had a good connection. So
It
then,
does. Go
oh,
ahead.
go ahead. No.
No, ask your question. Ask your question. I agree. I'm excited that with that word. I think it's a good word, especially if you have power. There's all kinds of research. The more power you have, the less empathetic you are because you feel like you know. And so an attitude of deference puts you in a better situation for getting to empathy. So I'm excited she used that word.
So then, with that understanding, right, do you see like any challenges in introducing empathetic thinking, empathetic practices in business, whether that's the business of healthcare, business in other places, because there's such in some institutions, power is what people are searching for.
Well, there's different kind of leaders, okay? So there are people that lead out of authority and power, and they very self-centered leadership, right? There is a self-centered leadership model in business, and then there's a servant leadership model in business. They both exist. People are successful with each of them. I prefer the more servant leadership model of business, and I had the good fortune, of seeing that model in the CEOs of P&G. So A.G. Lafley, who was the big believer in getting empathy and design into how we did our work, so we apply it in business all the time. He was a big supporter of that. He's a servant leader, and he deferred to experts, and so he would ask you what you thought, and he would listen very closely and observe, and then decide if he was, going to take that action based on what you had said. But he definitely was, and as were some of his predecessors. And the current CEO of P&G, David, I know quite well. He is a person that listens to others. So I think that both can succeed. I think it benefits business to be more empathetic. It's not that you're saying that I'm going to do exactly what you want, but I'm at least going to understand where you're coming from, so I see the full picture and I don't make a premature judgment on what to do, right? And so empathy has always helped me in my business decisions. When I have gotten that kind of data, I become wiser in how I choose. It doesn't mean that I solve every person's point of view. I may not do everything everyone wants, but I've made a wiser decision because I've understood exactly what's going on, not just the surface of it. So empathy gets you underneath the surface, which allows better decision making. So it is I think, a tool for business as well as the healthcare world. I think it helps you quite a bit. Did that answer your question, sort of,
Yes, that was
Matthew?
wonderful. Thank you.
Okay, and then Jonathan had one. Should this thinking be influencing how we select applicants for med school? It is some med schools. So there are a couple of med schools now in the Northeast that now are looking at people's kind of their backgrounds and looking and interviewing them for empathy, those kinds of things. So I know for a fact that, and I heard it on NPR, the professors interviewed, and I cannot remember the school, but it's in the greater DC area is what I'll say, but I cannot remember the medical school. But they absolutely were starting to look at empathy as a characteristic of future applicants. So I think it's coming. And I think that's because Mayo Clinic and Cleveland Clinic have really demonstrated the power of it in their care of people. They have better outcomes because they treat the whole person, not just the diagnosis. Same with Cincinnati Children's and my daughter. She has a very difficult cancer to cure, and she has better outcomes because they treat her as a human being. And so I do think that it is going to infiltrating the med school application process. It's just started, but it's in kind of the greater DC, Maryland area. And I'm sorry, I can't remember the name of the med school, but it is now, they did a whole, if you look in NPR, there's probably the podcast of the interview where they talked about how important empathy was in med student application character. Is it George Washington University? Someone just wrote in George Washington. I bet it probably is. I don't remember, but yeah, that's probably right. So any other questions? How are we? Anything else? We're good?
I think so. Well, thank you so much, Ms. Tripp. You provided really important insight on the importance of empathy in the healthcare field. We really enjoyed your story, your experience, but I'll pass it on to Elizabeth to introduce our next speaker.
Great. And last comment is just Google Brene Brown on empathy so that you are clear on empathy versus sympathy. Because I'm not saying sympathy, I'm saying empathy. And she has a 4-minute video that if you Google it, you'll get a great definition. She does a great job of it. And I didn't have time to share that today, but it was one of my backups if we had time. So, all right. You all have a great rest of the afternoon.
Thank you so much. We'll definitely have to look into that.
Bye-bye.
Bye. Okay, so I'm going to go ahead and introduce our next speaker. So Dr. Christine O'Day is an associate professor